Hello friends, echocardiography is an essential tool to assess the hemodynamic status in critically ill patients, to classify the shock, to assess for fluid responsiveness. Doppler is the language of blood flow and the direction. In this video, I'm going to cover what the Doppler principle is, what are various Doppler modes available in your ultrasound machine, and how it is used to assess various hemodynamic parameters in ICU. So Doppler technology allows the determination of the speed and direction of blood flow by utilizing the Doppler effect. The Doppler effect or Doppler shift is the change in the frequency of a wave in relation to an observer who is moving relative to the wave source. The classic example from our high school physics books is the pitch of the sound increases when the car approaches to the listener. Then suddenly sound pitch decreases as the car moves away from the listener. Here, in case of medical ultrasound, the ultrasound probe acts as both the source of sound waves and also the receiver. The moving object in our case is the reflector, which are blood RBCs. To calculate the velocity of the blood flow, the frequency difference between the emitted and reflected ultrasound waves is analyzed. And this difference is called the Doppler shift. The Doppler equation uses the measured frequency difference between the transmitted and reflected sound waves to derive the velocity of the reflector, that is, in the blood RBCs. In this case, the angle of insonation is very important, which is also the optimal angle of incidence or beam flow angle. Usually, angle is fixed between 0 to 60 degrees. That means that the operator must align the axis of Doppler integration as close as possible with direction of blood flow. The angle of insonation is changed with the view selected, the probe movements, and the angle correct function, which is present in the most ultrasound machine, which can correct the suboptimal alignment. The cosine of 90 degree is 0, so you cannot keep the angle of insonation at 90 degree. Now, you must know that there are 4 types of Doppler modes which one can use: color wave Doppler, pulse wave Doppler, tissue Doppler imaging, that is TDI, and color flow Doppler, that is CFD. In continuous wave Doppler, ultrasound pulses are continuously emitted and received by 2 separate transducers. Continuous wave Doppler is used to assess the valvular regurgitant jet velocity like MR and TR jet velocities, and also the rate of pressure rise in the left ventricle during systole, that is dP by dt. The pulse wave Doppler sends the short pulses of ultrasound and analyzes reflected sound waves between the pulses. By sending short and quick pulses of sound, it becomes possible to accurately measure the velocity of blood in a precise location and in real time. It is used to estimate the volume time integral and E by A ratio to assess the diastolic function in advanced echocardiography. The tissue Doppler imaging method depicts the myocardial motion measured as tissue velocity at a specific location in the heart. So in this case, E prime or E upon E prime, which is a non-invasive estimate of left atrial filling pressure, is measured using the tissue Doppler imaging, which may be available in your machine. Now, we will talk about the color flow Doppler or color Doppler, which is a development of pulsed wave Doppler where the frequency shift is mapped onto the 2D image with flow towards and away from the transducer plotted as different colors. It screens the 4 valves for leaks and other abnormalities. For example, Doppler color flow mapping is widely used to assess the severity of the mitral and tricuspid regurgitation. So that's all for today. I hope that you must have understood the Doppler physics used in advanced echocardiography, which is commonly used nowadays in ICU. Thank you so much.